With Medicare Advantage, you have what's called a maximum out of pocket. So if you ever hear me say MOOP, that's what that stands for. The MOOP, there it is. All right, so the MOOP is it's going to be a certain amount. Let's say the MOOP's 5,000, doesn't matter. You're going to have a co-pays and co-insurance for each service. These add up to the MOOP. So once you hit the MOOP, you don't pay no more. No mas. Okay? But with Medicare Advantage, you definitely have more out-of-pocket exposure, right? Because remember, on the Medicare supplement side, even if you get a plan, a high deductible G, the max out-of-pocket is $2,800. Well, with Medicare Advantage, it might be $9,000. Let's say it's a $9,000 move, right? We don't want to pay that. That stinks. It's a bummer. So what do? We cover it up, and we'll get to that in a second. With Medicare Advantage, what's really cool about it is you have your drugs are included. Dental is included. Actually, we'll put DVH. Dental, vision, and hearing is included, which is really cool. There's another thing called over-the-counter benefits. If you have stuff like chronic issues, they have certain plans called C-SNP plans. Like if you have diabetes or heart issues, they have plans that'll give you, healthy grocery cards. You can use that to buy healthy things to eat. They want you to be healthier. You can use it to buy over-the-counter products. You can use it to buy, there's just certain things. Dental, vision, and hearing is going to be included almost every time. If it's not, you just got a poor area. So your drug coverage is included. Dental, vision, and hearing is included. You have over-the-counter benefits. You have certain plans for certain types of people, right? Another one would be Medicaid. So if you have Medicaid, you get what's called a D-SNP, dual special needs plan. So you have chronic special needs plan and dual special needs plans. We'll go deeper into these in another episode one day. And we'll probably show you some examples and go over that with you. But Medicaid plans, dual special needs plans. These are the ones that give you the most benefits. They have, OTC credit. You can use it for groceries, and you can use it for utilities. So a lot of people use it for utilities or even rent assistance. So with the Medicaid plans, if you're on Medicare and Medicaid, it does not make much sense to not have a dual special needs plan. However, if you have Medicare and you have Medicaid, your expenses are very limited. Medicare pays that 80%, and if you have a certain level of Medicaid, which we'll dive into deeper later, that level of Medicaid should cover that full 20% for you. So you don't have to get a dual special needs plan, and you should have all your medical expenses covered, including medications. But those plans are there for you depending on your area. So just make sure you keep that in mind.